physiological studies is that our body, each and every cell regenerates itself and replenishes itself. For example, hemoglobin takes 3 to 3.5 months to regenerate new
90
cells.
days totally
90
got new
days,
hemoglobin.
yeah, right. And in 7 years, almost every cell of our body gets replenished.
Yeah.
So while this happens, we keep supplying the wrong food materials because everything has to be made out of the food that we eat into our mouth.
Food.
So what will you do if you keep supplying the wrong bricks to the house? You build a weak system.
Building.
And that's what is actually happening over the period of decade to decade. We are seeing the health problems not multiply, they are actually going exponential.
Exponential growth is there.
Exponential growth of diseased persons and diseased conditions, and we have no answers. So 15 to 20 years back when I started talking about immunity, doctors and friends and everyone is looking at me. What are you talking? What are you nonsense? This is how they treated me. But then I have been telling, without immunity, without dealing to know how to take care of this microbial pathogenic microbes, keeping at bay is the first and foremost important thing for the human body, because many of the diseases, so-called chronic diseases, start from simple thing like cold and cough infection. By not able to manage it properly, we leave toxic things in the body, which then slowly turn itself into chronic disorders. Many instances like people losing their hearing capacity, not having the smell, that is because of being not treated right by the so-called doctors in the form of antibiotics, in the form of steroids, in the form of painkillers. We are screwing up one after the other. The conditions of being wellness is screwed up by the medicine. So
right.
It was very clear for me that medicines and trying to create more number of medicines, more antibiotics, we are only educating the microbes to be stronger and stronger and stronger.
Okay.
And everyone has the experience. If you're a doctor, that ICU conditions, you have to clean up the system with antibacterial drugs first, even before you know what you have to treat the patient for. So this kind of unscientific things we have been propagating in the name of allopathic world, which is supposed to be scientific. So all these gaping holes clearly indicated that what we need to take care of things is not to kill the virus, not to kill the chicken, not to kill the bat, not to kill
but increase the immunity.
Yeah. So these are going to be there. You cannot live without all these wonderful things in nature. So you have to become strong. So how do we become strong? To make the antigens in wide variety be exposed to it even before you are growing up. So by the age of 10 or 12, you need to be exposing your babies with various kinds of vegetables, greens, and various kinds of fruits and various kinds of grains. So people have forgotten that the basic food is grains. So people think, oh, I eat rice and wheat, then change my other things. So I will have haldi tea, I will have ginger tea, I will have this. And people think they get immunity. But basic glucose imbalance and microbial imbalance is screwed up. Without that, you cannot get immunity. So I'm talking about health as a whole. It is not to cure diabetes, it is not to cure that, it is not to cure this. So you want to tinker somewhere, something else happens. So how do you do that? So you should not do that. So from the beginning, even before the baby is conceived in the womb, you need to understand the mother and father, the sperm count, everything has to be healthy. So this is how my journey began and started working out all these details. And so to produce the right microbes in the intestines, guts, because that's the basic first defense, you need to produce the food that harbors this wonderful symbiotic bacteria that can pass through your stomach, acidic condition, and then go and stay and make colonies in your intestines. So that is possible only through various kinds of leaves, various kinds of grains, various kinds of vegetables. For example, I'll give you one. You have this mirchi.
Yeah.
If you remove the stalk, you can just rub that on any microbial plate. You will see lactobacillus coming up.
Okay.
And that's how our ancestors fermented the milk. If you didn't have curds to start, they just put 10 or 15 green chilies, removing the stalk, into the boiled milk. You will get wonderful curd tomorrow.
Curd.
Like that, each and every vegetable and greens have wonderful microbial populations which will start, and that's why they are called prebiotic food. So they go and harbor wonderful microbes.
लेकिन हम तो अपनी एंटीबायोटिक्स के थ्रू, पेस्टिसाइड्स के थ्रू उन सारे जो माइक्रोब्स है उसको मार रहे हैं, और वो जिस चीज को हमारा हेल्प करना है उसी चीज को खत्म करके जो बिग कॉलोनीज आर देयर. तो डॉक्टर खदर वली, इस जगह पे हम लोग जहाँ पहुंचे हैं, तो इस जगह पे बहुत सारे जो दोस्त हैं वो ये बोल रहे हैं, थोड़ा सा हम इसको हिंदी में भी लेंगे. तो आपने जो ग्रेन्स है उनको 3 डिवाइड किया है, नेगेटिव ग्रेन्स, न्यूट्रल ग्रेन्स एंड पॉजिटिव ग्रेन्स. तो जो आपका श्री धन्य है जो आपने पूरे वर्ल्ड को दिया है, उसके बारे में हम बताइएगा.
आई एम कमिंग टू इट. ये क्या है, ये माइक्रोबियल बैलेंस हम कैसे हमारा पेट में भरना है, and what is the basic source of these wonderful microbes. Many may think that if I take this decoction, that decoction, you will get different kinds. But भरपूर रहने के लिए हम खाना है. We have to have a staple food, and this staple should be defined. So if you eat rice, and many people think you can make rice porridge and ferment and take microbial, but then the rice itself has glucose imbalance. So that means it produces a lot of glucose and floods your blood and intestines with glucose. So glucose-rich, loving microbes infest. And that's how you start infesting even the microbes that are pathogens.
Right.
So that means we need to define these grains which do not produce glucose in a hurry-burry. They should not flood the glucose. So
slow release of glucose should be there.
Slow release of glucose into the bloodstream. We should not flood that. So that is the characteristic of a grain. So I started looking at this list of grains that the human race has produced, and actually worked with 20 grains on a diabetic patient, HbA1c being 8 or 10. I started feeding, asked him to take porridge of ragi, porridge of bajra, porridge of rice, porridge of wheat, porridge of kodo millet, porridge of... So each day you collect his urine and check for glucose after 1 hour. That is called renal tolerance test. Sab logon ko malum hai ye. So once you check the renal tolerance test, whichever grain has glucose appearing in the urine, that means it has failed the renal tolerance test. That means the glucose is coming like a flood into the blood. Right. Within 1 hour, you get the glucose in your urine, means it has gone through the whole cycle like this. And these 5 grains come out on top. It takes more than 4 to 5 hours to see the glucose in the blood, in the urine of the patient. So that's how I made the list that is present in the book. Once that is done, it was very obvious for me that these grains harbor wonderful microbes. So I started making fermented porridge. Khameer bolte hai aap Hindi mein.
Khameer, yes.
So ye patients ko hum khameer pilane ko shuru kar diya. Lo and behold, in 3 weeks, people started becoming well, because the imbalance that is created in the gut is started getting complete. So once we started correcting the glucose imbalance, microbial imbalance, and the hormone imbalance, not taking milk, not taking coffee, not taking sugar, automatically starts correcting. So I found the wellness returning back to almost all kinds of patients, be it a heart patient, diabetic patient, cancer patient, dialysis patient, 6 weeks to 9 weeks. So that's why I keep telling people, you have any problem, start with this khameer. Daily once at least, if not 3 times. Okay, so that is how we can correct everything. start correcting things. And lo and behold, in a matter of 2 years, we started finding almost all the so-called symptoms of diseased condition disappearing, because we actually are imparting the imbalances being removed in single shot by choosing these wonderful grains and eating different kinds of greens and vegetables. And being vegetarian is the most important thing to become healthy. So health depends on completely the choice of food, not what you do after you get the sickness.